Namaste. And this is Srinivasa Madenhalli. I'll continue my conversation on the health data and data platforms. So in the earlier videos, what I spoke on the health, global health, progress and the challenges. And in this video, what I'm going to talk about more about the data and data platforms, and also the AI platforms that have come and which can really greatly help us to kind of create this content and provide data and explanation, etc. So when I started doing this, collecting the content for this video, it didn't strike me to leverage ChatGPT or Google Gemini, the new AI platforms, who are essentially the super experts available globally for anybody, for almost on any topic. Okay. So then what I started it was a sort of collecting some factors and organizing those things. Essentially, these are the factors that would impacts individual health as well as public health at large. And then they start of putting these factors and start of organizing them, structuring them, organizing in certain way so that they can be explained. And okay, then I switched to ChatGPT and Google Gemini, and then asked this question. Okay, and this is what with ChatGPT gave within, less than few seconds, So it organized everything, the factors that would impact the individual health as well as public health. There are many factors. There are biological, behavioral, social, environmental, and healthcare related factors, right? And these factors, they're all interlinked, interact with one another, and can either promote good health or contribute to poor health outcomes. Okay. I'm not going to read through the slides. Essentially, the kind of the expertise that is available at our fingertips for anybody at any time, right? It's unbelievable. So what I tried to do it, with this kind of thing, probably I would have taken half a day or a day to kind of come up with this content. And the ChatGPT came up within few seconds, right? So in the biological factors, there are genetics, age, sex, immune system, etc. In terms of a behavioral and lifestyle factor, there are diet, nutrition, physical activity, smoking and substance abuse, sleep habits, stress and mental health. These are the behavioral and lifestyle factors, right? Which impacts the health positively or negatively. And then the social and economic factors, right? So unless you have reasonable income and also reasonable socio-economic status, you will not have good health, because if you don't have the income, you will not be able to afford food, shelter, basic necessities, and even the healthcare itself, right? So the medicine, doctor access, care access, and etc. Right. So for all that, you need basic income. And education plays a major role in terms of improving the health, in our ability, kind of understanding of the disease, whom to approach, what to do, what not to do, and etc. Right, that all helps. And then the education also helps us to kind of develop us a basic understanding of the biology, basic understanding of the living conditions and better living conditions, etc. And then you need social support and relationships as well. So your family relationships, your community relationship, neighborhood relationship, they all play a significant role. And the occupation, some of the occupations are, risky. We can think that some of the workers in mining, they go through severe stress, and they go deep under the earth, and they lack good quality air, and they lack sunlight, and they go through a lot of stress. And this is one of the examples. Similarly, a bus driver will be sitting for 8 to 10 hours, continuously under driving thing. There's even people sitting in simple shop, right? They could be sitting or standing in one place for extended period. That induces a lot of stress and both physical and mental stress. There are many jobs, which are health wise hazardous. Even what we call white collar jobs, they are also not so conducive for health. You will be deprived of sunlight, fresh air as well, right? So, and at the same time, people work in the sunlight and fresh air, like farmers and peasants and the laborers. Many times they get kind of get exposed to sunlight. They get, burn in the sun, and there are other hazards as well. So there is no ideal job, but I think we'll have to balance our job with the biological needs and also mental needs. There are many environmental factors. Now, obviously, we need air and water, right? So, the air quality has to be good, water quality has to be, living condition, housing quality has to be, the houses have to be of reasonable size with good sunlight and ventilation and spacing between the houses, sufficient space inside the house so that we don't kind of, get suffocated. And sanitation has to be there, and so on and so forth, right? The climate change also plays a role. Because of climate change, there can be severe weather conditions that can trigger a lot of new pandemics and new health issues. If there is a very high temperature, a lot of people can get impacted with sunstroke. If there are severe floods, there may be lack of good drinking water, etc. Right? Work environment. These are all the environment factors that will impact our good health and health at individual as well as community level. And healthcare access and quality. End of the day, so for some reason, people may fall sick, will fall sick, either because of infections or because of accidents or because of for genetic reasons, whatever, right? For various reasons, with age or the climate change, so or the weather changes, they can fall sick. When that happens, do they have access to the healthcare? Are there nearby hospitals, nursing homes? Are the medicines available and the diagnostics available? All that, right? In emergency care is available. Those are the things. The access and in terms of the services and the health insurance, not everything can be kind of affordable for everybody. The risk has to be shared. If there are 1,000 people, or 10 people might fall sick. So now, if you distribute the risk of 1 person going through excess expenses. So what do they do? Is if 1,000 people are covered with insurance, their expense, healthcare expense for this 10 people who fall sick, kind of distributed, right? That's what insurance does. It distributes the risk to larger population. Health literacy, right? So people have to be understand basic understanding of the biology, diseases, and basic hygiene, etiquette, etc. And then a lot of preventive care has to happen as well, right? Regular screening has to happen in terms of with age related things, and then time to time, children have to be screened as well. Whether they're growing up properly or if there are any issues in terms of eyesight, height, and weight, and etc. Right? So there can be anemia for various reasons, either nutrition or infection, etc. Right? Or the even many times children will have worms in their digestive system that can suck a lot of nutrients and make the people anemic or nutrient deficient. And there are cultural behavioral norms as well. Some cultures are very progressive in the sense that they give a lot of importance for the hygiene, and in the process they will have good health. So there are some cultures they may not give so much importance for the hygiene, so they may suffer as well. So on and so forth. And really, some of the religious practices which can either help or harm the things as well. Some dietary restrictions or overeating, undereating, whatnot, right? So they all many times influenced by religions and cultures as well. And then on top of that, government, what government provides, in terms of the regulating the prices, providing the services, etc. Right? And the infrastructure, and infrastructure is not the health. You need good transportation. You need communication. You need water, facilities, electricity. All those things are have to be provided by the public policy and infrastructure. That many times they're provided government themselves or through authorized. Private players with some oversight by the government. Right? And then obviously there are genetic and epigenetic factors. So essentially, what I'm trying to say is here there are several factors that impact our health, and at individual level, at family level, and community level, nation as a whole, and the world as a whole. Right. So these there are various things that impact, and the actions have to be such that all the these things are considered, and there are the multi-pronged approach to improve the overall health, public health. To understand all these things, we need data, right? So at individual level, what is happening, at community level, what is happening, at state and national level, what is happening, global level, to understand whether things are going well, not going well. Right? We discussed earlier, we talked about the lifespan expectancy, maternal mortality, infant mortality, infectious diseases, incidences, deaths, infections, etc. Right? For all that, we need data, and also spending, and so all that we need data. And unless we have the data to understand where we are and where we want to, we cannot plan it. Okay? So, and also we don't know how to prioritize things. So the data I've used, they're all publicly available data. They're amazing quality data and platforms. How easily we can leverage them. I've listed them here. These are all publicly available. A lot of these things have evolved over the last 100 years. Sorry, last 10 years, and it's so easy to get. And so and the global level data provided by the World Bank, UN data, the World Health Organization, and the IMF. These they give really credible data, very good visualization capabilities. We can easily compare countries in various aspects. There are various macro economic data, macro health data, macro environmental data. It's available, right? And they provide data to come up with a good story, interconnected stories, to understand that data, make sense out of it. Websites like Our World in Data, it's a small set of very motivated people by Oxford University has created this non-profit organization called Our World in Data. They take data from these global agencies and they create narrations. I'll show this in some of the data, the platforms. Okay, and the worldometer, many of you would have recognized that this was heavily used during the COVID to know the trends. And Wikipedia is there. It's publicly a crowd sourced, a crowd pulled, the wiki, encyclopedia. It's amazing, So it has beaten everything, all the for-profit encyclopedia because of sheer number of people involved. And creating it, editing it, and evolving it, right? It's one way people make it is because anybody can edit it. There can be a lot of misinformation. Yeah, that could be 10-20% of the cases, but most of the times, there's really good, well organized data, and most of the time there are a lot of references to go and cross verify as well. And on top of this non-profit, organization, there are for-profit organizations like Statista, Macro Trends, and India Stats, etc. They provide very well curated and organized data collected from various organizations, from for-profit, for government, and also from their various sources of self-collected data as well. They can be used for commercial purposes. Right? So they provide data, a lot of data for free, and a lot of data is available for a fee, and it's very reasonable for organizations, if not for individuals. Our World Bank data is amazing website. You can see that data.worldbank.org, and for the IMF, this is the imf.org slash en.data, right? And then there is a UN websites as well, where we provide a lot of data. One of the things I really love is the Our World in Data. So let me open this and to show that how good this is. Okay? When you click this one, it opens data, and is extremely rich set of analysis have been done. You can see the kind of, you see the topics themselves are extremely well organized. You can say population, demographic, health, energy and environment, food, agriculture, poverty, and economics, education, knowledge, etc. And each of them have large set of the the subtopics. You see, for example, population growth, right? So they give a lot of visualizations and very easy to use visualizations with good narrative. One challenge is that they give in a very broad global view of the data, right? So if you want to take this data and narrate it in the local context, in our own country level, so one of the key thing is all these global data sources, World Bank, IMF, UN, WHO, etc. They provide national level data. Essentially, they take data from national agencies and aggregate them, harmonize them, clean, kind of standardize them, so that it becomes easy to compare different countries. Whereas the our world in data take the data and create these narrations, right? The challenge, as I said, they can go to global macro level things, right? So to tell stories specific to our country, then somebody has to look at it, how we are doing over period, how we are doing it to our comparing, the neighborhoods, and how we are doing compared to other countries, right? And we have every country has their own, history and evolution, right? So we cannot simply compare country A and country B straight away. There are this historical context as well. Yes, it helps to compare. For example, life expectancy. India's life expectancy at average life expectancy 71 years, whereas China's is 79 years. So it's significantly high for the same kind of population. But there are various factors that are impacting. Okay? So we have to somebody has to tell the story very well, and our life expectancy is very comparable to our neighbors, right? So it's Pakistan, Bangladesh, to some extent Sri Lanka. Sri Lanka is ahead of us, right? So if you see this, some of these, the data are really really good. So this is the kind of standard visualization they use. As you can see here, the population from 1950 to 23. You can see that two most populous countries data they've provided, India and China, right? You can see that China was about 25, anywhere from 25 to 50% higher in terms of population. In fact, 1950, by China's population was about 50% higher. In 75 years, we have reached the population, we have crossed the population of China, right? So if you see this, China's population growth started decreasing from 1980 onwards, and it plateaued, whereas India continued to increase, though our rate decreased, but we continue to increase. This reduced population growth really helped China to improve the existing school, improve the existing hospital, improve the existing urban and rural infrastructure. That population stabilization really helped them to move forward. Whereas we continue to struggle with the ever growing population, providing basic sustenance, basic food, basic housing, etc. Right? So the schools. So we had to keep building new schools, new hospital, new housing, and new infrastructure. Right? Whereas in China went to the next level. Apart from other things they took, they initiated. So this is one thing, the map gives the trend. And if you just go to the map, this is the chart view. And if you go to click the map view, you can see that, the population density here, right? You can select the country if you wish. And if you go to the chart again, you can pick the countries you want to select, for example, where is it? So boxes. Generally, they will give the country selection. Okay. Let me go to some of the other maps to show you. See the population by age group in India, as you can see this, total population will continue to increase, which is scary thing. And as per the projection, we'll reach about 1.65 billion. There's another 20 crore population will be adding, and then will start decreasing. So I think, in my opinion, it's a significant risk. We already have added, as I've said in earlier, 45 crore in the last 25 years. Adding another 20 crores is kind of, in my opinion, it's a ecological and social and economic disaster. Okay, so my point here is that it's an extremely useful website. Please leverage this to get to know about the world at large and various aspects of our society and economy and politics at large, right? Especially economy, environment, and ecology, etc. Right? And but we have somebody has to give some narration for the local context. So let me come back to this health data, right? Uh, where is it? So there, as I was telling you about the global websites, I mean data websites, and then there are a lot of local India specific websites as well. Data for India. This is a new for non-profit, organizations. They give really good data as well. So they now they're telling, creating a story, data stories for India data. And there is India Data Portal by ISB, India International School of Business, and India Data Insights. And there are some of the government specific websites are that Karnataka is Karnataka data.gov.in. If you just go to data.gov.in, that's the data platform, open government data platform of India. So the challenge is, different departments just dump a lot of data there. There is no standardized. Many times you have Excel, CSV files, images, whatnot. So there's no standard, but at least some data is available. And if you're tuned into certain topics, probably you will get periodically getting that data. For example, crime data. So you can tune into that. So ndap is from Niti Aayog, National Data Analytics Platform. They give a lot of curated data, standardized, interoperable data from various sensors and sample surveys, and some of the departmental data. Key thing is here, the data is interoperable. So the data, most of the times, they provide state level data. I mean, you can compare different states, just like the World Bank and IMF give data for different countries. Many of these national data portals they can have, they provide state level details. Sometimes they also have district level, panchayat level, but there are fewer and fewer of them unless the data is collected by some central agency with standard data structures, etc. Avalokana is a data platform by government of Karnataka. So where you get a lot of the financial details, the budgetary allocations and expenditures, etc. You can get that. Statista, I already told about it. Okay. So the key thing is that there are many platforms. Somebody has to leverage this one and create narration. So the whole idea for this one is about explaining about the data platform. In the next video, what I'm going to talk about is the data challenges. So there are a lot of data available, but there are quite a bit of data challenges. I will talk about it in the next video subsequently. Thank you.